Let's say that I'm one of your clients and I've been on medication for quite some time, and I'm ready to be off. What does the process look like in your care?
The most important piece of successful work in reducing or discontinuing these very powerful medications is that the client feels comfortable and empowered to do it themselves with my help. So I say to anybody that comes into my office and wants to reduce their medication, I say, okay, we will get to that. But let's slow down a little bit. Let's see what kind of skills you have in dealing with emotional trauma and see how you are at that. Then we can begin to talk about you being ready to come off of them, because I don't want you to have an explosion of emotions that's in a way similar to what probably happened to you initially that made somebody think that you needed the medications in the first place. We all know from our drug lectures in school and from the media that heroin has a very terrible withdrawal process, and cocaine and all of these illegal drugs have bad withdrawal symptoms. These drugs can be more toxic than the illegal street drugs, but they have serious withdrawal symptoms, potentially, especially if you come off of them abruptly and cold turkey. I never advocate coming off cold turkey or discontinuing or even reducing your medication without a professional who knows how to do it successfully. A rule of thumb I use is that gradual is good. I say that actually for therapy in general, that for my inpatients, that therapy is not a quick fix. The way that I work takes longer than taking a pill, and you may end up feeling worse for a while than you ever had before, but that's the way to success. So in terms of the medication, a rule of thumb that I use is I never reduce any more than 10% of the total drug level being taken. So if you're on one drug, I would never go down more than 10% at a time. If you're on 4 or 5 drugs, I would never go down on more than 10% on the total amount of drugs that you're taking, if that's clear. That means that I would not go 10% down on each one. It would be 10% overall. If you're taking, let's say, 2 pills a day, every day, I would say, okay, this week, just take 1 pill one day. That means just cutting 1 pill out of the total and see how that works. And then the next week, you take 1 pill off of another day until after, that would be 7 weeks, you're only taking 1 pill a day. And then you would take 1 out. So that then there would be 1 day out of the week where you're not on the medication.
So it's always hand in hand. You're always there with them through each step of the weaning process.
Exactly. And the reason that it needs to be careful monitoring and also not a one-size-fits-all is that some people can discontinue a drug and not feel any different at all. Some people can reduce the tiniest amount and their whole body and their whole behavior changes. I never really know, and that's why I go very slow and sort of experiment with the person who is going off of the medication to see how it works. I still say, well, let's do it carefully and slowly, and let's see how it goes. I try to set the goals for therapy with the client, ask them, what is it that they'd like to get out of this therapy? And when people come to me on medication, I ask them the same thing. I said, so what is it that you'd like to have happen? It's that kind of respect and allowing the person to monitor themselves and monitor their own recovery as far as they want that I think gets why I get the results that I do.